So the DuPage Federation, where I used to work, is a nonprofit, non-governmental organization. And I like to say that our job is to figure out the hard stuff that is challenging our community. And we figure out what is going on, what needs to happen, and then with teamwork and collaboration, we are often able to make it happen. One of the things that we do is training and technical assistance. We think that knowing about public benefits is a core skill that human services and many health professionals need to know. And so we have been doing the training on a variety of public benefits for about 15 years. We also operate the Language Access Resource Center, which helps people who don't speak English get the healthcare and human services and education services that they need. Okay, so we're going to use a lot of acronyms today, and I'm not going to bore you with going through all of these. But if I don't, if you get confused by the acronyms, you should speak up and ask me to clarify it, and I'm happy to do that. So this is something that a lot of people do not understand, and that is that if you get cash from Social Security, you can be in one of two major types of programs, and the Social Security Social Security program has several subtypes. So the first one is that you get because either you or a member of your family worked under Social Security for enough time. Generally speaking, you have to have worked for 10 years or 40 quarters in order to qualify for Social Security disability. But when I say generally speaking, there are exceptions, but I will not go into those unless we need to. So the three main types of benefits under Social Security are retirement, survivors, and disability insurance. And we're going to focus today on disability, but I should tell you that there are some instances where folks who have cancer or whose family members have cancer are going to want to know about the other two types. So then the second type of benefits is supplemental security income. It's also called SSI. And that's for folks that have a very, very low income and have very low resources. And they, in order to qualify, they have to be aged, blind, or disabled. Aged over age 65, blind, according to their definition, or meeting Social Security's very stringent definition of disability. Okay, oops, I'm going to come back to that. Okay, so regular Social Security, or they call it RSDI, Retirement Survivors Disability Insurance, you have to first have sufficient Social Security credits, and you have to be a U.S. citizen or a qualified immigrant. And if you're applying for retirement benefits, you have to meet the age criteria. Or if you're looking for survivors benefits, then you have to be the surviving dependent child or spouse of a wage earner. Or if you are applying for disability benefits, you need to be disabled according to Social Security's definition and unable to do any work that exists anywhere in the national economy. And so to receive any Social Security insurance benefit, you must have had FICA taken out of your paychecks, or if you operate your own business, you have to have paid self-employment taxes. And so that's the FICA line on your paycheck stub. And FICA stands for Federal Insurance Contributions Act. That's a piece of trivia that you might want to know. And so, as I said, you generally need at least 10 years of work to access any of those benefits. So whose wage credits are used? The first thing they'll look at is, so if I'm the person applying, they'll look to see, do I have an earnings record that they can use? If I don't, then they'll look at my spouse or former spouse. And this is another piece of information many people misunderstand, and that is you can get benefits on the wage record of your former spouse if you were married at least 10 years. And then if you're an adult who was disabled before age 22, you can collect on your parents' record. And there's a few other exceptions, which I won't go into. Then if you're applying for retirement benefits, the earliest you can collect is at age 62. But if you apply at age 62, you get a significantly reduced benefit. And so if you can work until your full retirement age, you probably would want to do that so you don't get this permanent reduction in your benefit. So people talk about full retirement age, and that depends on when you were born. If you were It used to be that full retirement age was age 65. Then they raised it to age 66 for the folks that are around my age. And if you were born in 1960 or later, the full retirement age is 67. And so if you're disabled at age 62, should someone file for early retirement or apply for disability? And the answer to that question is absolutely, you should apply for disability if you are disabled. And the reason for that is that if you are found to be disabled, then you will collect the amount that you would have gotten at full retirement age. Whereas if you apply for early retirement at 62, you will get a significantly reduced benefit for the rest of your life. Okay. So here's an example. Jimmy is 62, and he was recently diagnosed with esophageal cancer. He is told that at full retirement age, which for him is 66, I think it's actually 67, but he will receive $2,056 a month. At age 62, he can receive a reduced benefit of $1,500 a month. See, that makes a big difference. Whereas if he's approved for SSDI, Social Security Disability Insurance, he can receive the full benefit of $2,056 a month. So then if you are applying for survivor's benefits, I'll probably tell you stories about my whole family today because I always use them for examples. And that is my sister's husband had throat cancer, and he passed away at age 53. And she is now 59. This was a few years ago he passed away. And so as the widow, the spouse of a deceased wage earner, she could qualify for widow's benefits if she were not working, but she is working. And if you're a widow, so you can get benefits on your spouse's account if you're a caregiver of a dependent child age 16 or younger. And sometimes grandparents raising grandchildren will fall into this category. Or if you're age 60, or if you're over age 50, if you're disabled and not able to qualify based on your own wage history, or if you're age 62 or older and not able to qualify based on your own wages. Then if you're the child of a deceased wage earner and you're unmarried, if you're under age 18 or up to 19 if you're in high school, or if you have a disability that started before age 22. So sometimes you'll find young adults with a disability say Down syndrome or cerebral palsy or something like that, that started in childhood, but their parents are retired or deceased, and so they're collecting Social Security on their parents' account. Okay, so here's another example for survivors' benefits. So Teresa is 52, and she worked only 2 years paying into Social Security. She stayed home and took care of kids. She's now diagnosed with ovarian cancer and is unable to work. Her husband died a couple of months ago, and he was the breadwinner in their family. She has no minor children at home. So she'll be eligible for Social Security disability insurance based on her husband's earnings record. And so to summarize those two, Social Security disability insurance versus SSI, the Social Security disability insurance requires the individual's work history or the spouse's work history. And the benefit amount you get will vary significantly based on how much your earnings were. You pay in 7.85% of your earnings, and then your employer matches that. And then depending on how much you earned and paid in, that dictates how much you get per month. There are no limits on assets or resources. And there is a waiting period before you can, I'm sorry, I'm trying to go back and now it doesn't want me to. Okay, sorry, here. Sorry, okay. Then for supplemental security income, that's also for disabled, elderly, or blind individuals, but it's only for people who have very little income, almost no income. The benefit amount is the federal benefit rate, which is a fixed amount nationwide. And then some states, including Illinois, have a state supplement. There are very strict limits on assets and resources. You can have up to about $2,000 in the bank, and there's a whole list of things you can have. You can have a house if you're living in it. You can have a car if you need it to get to medical treatment. And but it's a very strict ceiling on limits. And usually you get Medicaid eligibility if you are on SSI. The note that I skipped on the SSDI is that you become eligible for Medicare, not Medicaid, Medicare, after 24 months on SSDI or at age 65, whichever comes sooner. Okay. So to qualify for either one, you have to meet Social Security's very strict definition of disability, which is the inability to engage in any substantial gainful activity by reason of any medically determinable physical or mental impairment, which can be expected to result in death, or which has lasted or can be expected to last for a continuous period of not less than 12 months. So each of the clauses in that definition has a whole lot packed into it that we can discuss if we need to. And so, again, I mentioned earlier that the number of work credits that you need to qualify for regular Social Security disability depends on your age, and it can range from 20 credits or 20 quarters to 40 quarters or credits. Social Security doesn't use the term credits anymore for complicated reasons, but you get 1 credit for each $1,000 you earn. So if you earn $4,000 in the course of a year, you get 4 credits. And so they issue you the same amount you would get at your full retirement age, even if you're younger than that. So here's another example. D'Angelo is 50 and becomes disabled. His full benefit rate for when he retires at 67, he is $2,000 a month. If he's approved for disability benefits, he receives $2,000 a month. At age 67, to the retirement category, but there will be no underlying change in the benefit amount. Of course, Social Security usually has a cost of living increase each month. So in 17 years, when D'Angelo is 67, he'll be getting more, but it'll still be the same basic full benefit rate. Then if someone goes into the Social Security office or calls and applies, that will be considered if the person has insufficient work credits for regular Social Security and he or she is age 65, blind or disabled, and low income and low resources. So the resources or assets are $2,000 for a single individual or $3,000 for a couple. And the full benefit rate for a single person is $841 plus a state supplement if there is one. And for a couple, it's $1,261. It seems like there's an incentive to not be married, but maybe we don't necessarily need to go into that too far. And so I mentioned that you don't count in your resources one car or truck, one vehicle, the house where you're living, and the household goods, life insurance with a face value of less than $1,500, and or a burial plot or expense funds of less than $1,500. All income counts, including child support, alimony, TANF, state welfare benefits, everything counts. So bank accounts, other real estate, investments like stocks or bonds, life insurance in excess of $1,500, and money or property that you disposed of in the 30 months prior to application. They don't want people to, Congress made these laws, and they didn't want people to give away all their property and then apply to the government for money to live on. So you can apply online at ssa.gov for Social Security retirement survivors or disability. And for the regular Social Security, you can do the whole process online. Whereas for SSI, there is a disability report form you can complete online. And then you call their 800 number for an application appointment. So this is Social Security's website. Now I'm going to get really into the weeds. And so if you don't understand this, somebody can let Sue know that I need to slow down or clarify. So in the right-hand side of this page, there's a lot of information for someone who might be wanting to apply. And so you can look here for more information. You can get the basics. You can fill out the application form. You can get their disability publications. And I'm going to talk more about that in just a little bit. But this is something, if you're interested in Social Security disability, poking around on this website at ssa.gov is a good idea. And the address is ssa.gov/benefits/disability. Okay. So the disability determination process. I think we've got a question here. Sue, do we?
Yes, we do. Do you want to answer it right now, or do you want to answer it at the end? We do it now.
Why don't we look at it and see?
Okay. Yep. We've got a question. It seems there is no partial disability, say 50% or 75%. You're either disabled or not. Is that correct?
That is correct. The Veterans Administration does have partial disability. My dad got injured in World War II, and he had a 70% disability rating. So he got a check every month. But with Social Security, it's all or nothing. Good question. Okay, so let's say you have applied for disability. I encouraged my sister when my brother-in-law was sick to have him apply. And it was very tough for him because he kept thinking he was going to go back to work. And ultimately he didn't, but that's the kind of challenge you have. So the first step is you initiate the application at Social Security. Then they determine the non-medical aspects of eligibility. Do you have enough credits to qualify, or is there somebody else whose record you can qualify on, and that kind of thing. Then if that is the case, then Social Security transfers the claim to an office in Springfield called the Disability Determination Service, or DDS. And those folks are mostly nurses. They have a psychologist or two. They may have a physician's assistant, but they're medical professionals who are familiar with Social Security's rules and processes. And they gather records. You can make it go faster if, when you apply, you provide any medical records that you have. And they will certainly ask you for the names and addresses of any physicians or medical professionals that have been treating you, and cooperate with that in order to make it go faster. Then, after Disability Determination Service collects as many medical records as they think are necessary, they will determine whether you're disabled or not. If the medical records are not adequate, sometimes they will send you to a doctor of their choosing for an exam to give them more information. But the regulations say that if there are records from a treating physician, they have to give that the most weight. And of course, you're usually better off having your own doctor who knows you and has known the progress of your condition. You're better off having him or her provide the information to Social Security. And some doctors, not so much anymore, but it used to be that a doctor would give you a note on the prescription pad saying so-and-so is disabled, and think that will do it, and it won't. They have to have objective medical evidence that meets their standards. Then, after Disability Determination Service has decided whether or not the person is disabled, they return the record to Social Security, and Social Security notifies the applicant whether or not the application is approved. And that can take months, many months. So then, if a person has applied, the very first thing they ask is the person working and earning enough to constitute substantial gainful employment, or over $1,350 a month? And so if they are working, the application will be denied before anything else happens. And the reason for that is that ability to work is kind of a slippery thing, that for every person that you tell me is too disabled to work, we can go find somebody who's equally or more disabled who in fact is working. My dad at one point had I think a 90% disability rating from the Veterans Administration. And because he insisted on working, they lowered it to 70%. Social Security, it's 100 or 0. So if a person is working, they are not going to be found eligible. And so then if the person is not working, they go to step 2, and they look to see does the person have a severe medical condition that is documented? And if the answer there is no, they get denied. If the answer is yes, then they say, does that impairment, is that impairment found in their book of impairments? Is it equal or worse to to what's in the book? And if the answer is yes, you get an approval letter. If not, then they go to step 4 and maybe even step 5. Does the impairment allow for past relevant work? Did you ever do anything that you can do now? They take that into account. Sometimes people will, be able to do telephone sales, but they can't do anything else, which strikes me as a job I wouldn't want to do. But so they look at the person's past work history and they see if there's anything in their past history that they can still do even though they have the impairment. And if the answer is yes, then they get denied. If the answer is no, then they say, does the impairment allow for any other kinds of work? And if the answer is yes, they get denied. If the answer is no, then they get approved. So you can see there's a whole lot of opportunity for denial. And one thing that's very, very hard to explain to folks is that there doesn't have to be a job available in your local community. There doesn't have to be, if unemployment is very, very high and you just plain can't get hired, maybe discrimination on the basis of disability or whatever reason you can't get hired, that does not get you disability. So if there's a job you could do any place in the national economy, you can get denied. So that's why, going back to step 3 here, if you have medical records, first of all, and we'll go into this more in a minute, but if you have medical records, be sure that Social Security has them before they make a determination. So this is we mentioned the listing of impairments. It's also called the Blue Book because they used to publish it every year. Now it's all online. And I actually, last night, went through and read the whole chapter. You can see down here, chapter 13, under cancer, that basically lists all the different kinds of cancer and how bad it has to be in order to be found eligible. And generally speaking, when a cancer is first diagnosed, and if it's local, my mother had breast cancer, and she had a very small, locally specific lump in a milk duct. And you say that 3 times fast. And they don't find the person disabled right then, because most of the time that person will have surgery or another treatment maybe, and it will recover. Only if it has spread beyond the original site and some other problems will they be found disabled. There are some cancers that you get found disabled at diagnosis for a period of time, like 18 months, and then they reevaluate. So if you're applying on behalf of someone with cancer, it would behoove you to understand what the standard is for your particular disorder and make sure that the records reflect that. One of the things that's very, very difficult is that everybody, I'm thinking of the conversation I had with my brother-in-law who had throat cancer. The doctor was telling him he was getting better. He was telling everybody and himself that he was getting better, and really he was not getting better. And so that's not the time to be unduly optimistic. You need to be coldly realistic and make sure the record reflects the actual situation. So the person can be found disabled at step 3 and begin receiving benefits if adequate evidence is presented that the impairment equals the listings and the applicant is unable to work. And you have to connect the functional limitations to the inability to work with appropriate medical documentation. So if, for example, you are exhausted all the time because you've been getting radiation treatment, the doctor needs to say that, you know, in so many words, that you can only be, you know, be on a job, you know, 20 minutes at a time, and you cannot work of a real job because of your fatigue, or whatever other functional limitation it applies to you. And so what is medical evidence? It's medical records from all of the treatment sources that you've had contact with. It's provider statements, and there is a form for that, a listing of your prescription, and you can also submit statements from friends, family, and other service providers. I've been familiar with a situation where we got a statement from the person's employer that they would just love to have him back, but he just couldn't work. And that turns out to be very helpful. Doesn't replace medical evidence, but it, you know, it's very helpful in presenting a full picture. Because remember, the people that are making these decisions never see you. They don't know you. And so then when the applicant is determined eligible, they send a letter. And all Social Security benefits have to be sent electronically, either to a bank account or you get a Direct Express electronic benefits card. And so how long does it take? When can benefits begin? And that varies. For retirement and survivors benefits, you can start collecting within a few months. SSI begins the month after you applied, or there's a thing called the protective filing date, whichever one is earlier. SSDI, regular Social Security, begins 5 months after the date of onset, or no earlier than 12 months before the application, if the onset was earlier. So what my brother-in-law could have done, and in my opinion should have done, is once they realized that he wasn't going to be going back to work, they could have applied for his disability, and they would have gone back 12 months earlier. And they would have collected. My sister was, I think, a saint, because they had 2 kids in college, and she was working a very demanding full-time job and supporting the family. And I think a little bit of, you know, of extra income would have been very helpful to them. Okay. Then, so here's some examples. Lester calls Social Security for an appointment for SSI on February 26, 2022. This is his protective filing date. His interview is completed and the application is signed in late March. And he is determined disabled and approved for benefits in May. And so he gets benefits with back pay beginning in March because he applied before the 1st of March. Kima applies for SSDI, regular Social Security, on that same date in late February. Because of compassionate allowance, and we'll talk about that in a minute, Social Security processes her application quickly, and she is determined disabled and approved in May also. Social Security determines that her date of onset was in June of 2021, and so benefits are issued starting 5 months after that, in the 6th month from November 2021 forward. So sometimes folks will get a good sized check when they first are approved, because there are those months while the process was going on that they didn't get a check. Then there are a couple of ways that somebody with a very severe condition can get benefits quickly. And again, this is, I didn't tell you this, but my first job out of college many, many years ago was working for a US congressman. And so when I was 22, I was the person that folks got on the phone if they called their congressman for help with a Social Security problem. And so at one point, my boss went to a town hall and came back with a stack of pink message slips from people, and by a stack, I mean 200 people who had Social Security problems. And the regional office sent 2 very wonderful gentlemen over to our office to help me sort through that. And I had an intensive training in Social Security in working through those 200 cases. So since that time, Congress has made a couple of categories of expedited payments. One is, it's called expedited payment, and that is the SSA worker approves based on the likelihood of approval. So if you have a condition that is listed, in the Blue Book, and you can come in and you have records in your hand that you can prove you had that condition, or say say someone is a quadriplegic and comes in their electric wheelchair, they get expedited approval and they can start immediately. Then there's a second category called Quick Disability Determinations, QDD, and they have a computer-based algorithm that screens initial applications and can approve very quickly. And those benefits begin 5 months after the date of onset. Then if you didn't get either of those 2, there's compassionate allowance, which is a list of specific conditions, and I'm certainly not going to click on that blue link, but you can, that permits quick handling of the case. The worker in the local office can designate that, and the same rules to evaluate a compassionate allowance apply, but it's not a long process, and as long as they have medical records documenting the condition, it'll go very quickly, and the benefits can begin 5 months after the onset. Social Security has a list of hundreds of conditions that qualify for this, and most of them are thankfully very rare, but you might want to consult that to see if your condition is listed. So here's the list. This is, sometimes I like to read this kind of thing because then I'm more familiar with the kinds of things that they are currently considering compassionate allowances. And Social Security will add, and I've never heard of them subtracting, but they regularly will add, so it's worth keeping up. You can see under the A's here, acute leukemia is one, adrenal cancer, and a bunch of other things. Non-Hodgkin's lymphoma, all of those, are types of cancers. So you might find your condition on the compassionate allowance list. I didn't tell my brother-in-law about this, but his throat cancer was on the list. And he would have gotten approved very quickly had he submitted the application. So then there are auxiliary benefits. If the wage earner files for their own benefits, retirement or disability, if they have a dependent spouse or children, they may be able to access auxiliary benefits as well. My dad had a stroke at age 50 and died a few months after that. And so he had 2 kids in college and 1 in 5th grade at the time. And so he got additional payments for that. The total varies, but generally the dependents get around 150% of the full benefit rate. they generally get no more than 3 times the full benefit rate as a total family benefit, but that can be a substantial additional amount of money. And the auxiliary benefits are not available with SSI, but if someone is applying for SSI and has dependent family members, sometimes those dependent family members may be eligible for other benefits like TANF cash or general assistance. And so they're issued when spouses or former spouses are age 62 or older, spouses under 62 caring for a child younger than age 16 or a child with disabilities, and the child is eligible for benefits, children up to age 18 or 19 if they're full-time students, and children with disabilities. And Social Security has a very strange term that when I first heard it, I went, huh? And they call it a disabled adult child. And that's an adult who has a disability that began in childhood. So keep those in mind. Now here's an example of a family. Jimmy, who I think is the guy with esophageal cancer we talked about a bit ago, started collecting SSDI at age 59. And he's married to Beatty, who's age 62. His Social Security benefit is $2,000 a month. Beatty does not have her own wage history. She can receive an amount equal to half of Jimmy's benefit, or $1,000 a month. Now, here's another thing that I used to get panicked phone calls about. And that is, if Social Security thinks your condition is subject to improvement, they're going to schedule it for a continuing disability review about every 3 years, or sometimes it's sooner. And they do 2 types of reviews: medical, which is, does your condition still meet the listings? And then the second one is a work review. And that kind of review is triggered if you return to work. And again, coming back to probably the first sentence that I said, is that if you are working, they're not going to consider you disabled. And so, but there are ways you can work and still collect disability benefits. We'll talk about that briefly later on. So if they don't do a continuing disability review based on work activity, if you've received disability benefits for at least 24 months and you're participating in the Ticket to Work program. The Ticket to Work program is, we're not going to talk, that doesn't go into more details, but it's a pretty cool thing that I really like, and that is the Ticket to Work. I'm sorry, I'm there. Okay, Ticket to Work is a work incentive program where if you have a disability and you want to work, you can get special services to help you either get trained for something you can do even though you have a disability, or get supports on the job to help you work. And you also get a trial work period where your earnings don't count against you for a period of time, around 9 months, and sometimes that is even longer. So here's the Social Security website, and the first thing you do is to start an account, ssa.gov/myaccount. And so that's where you can request a replacement Social Security card, check the status of your application, estimate your future benefits, or manage the benefits you already. So here are some web links, and I think if you want to take a screenshot of this, you can save them. They all start on the ssa.gov website, and that blue book, although it's certainly kind of a depressing thing to read, it's what you really want to know about the particular condition that your person has. And so those are, are some places to become familiar with. There are also advocacy organizations that will help people with Social Security benefits. And you may want to become familiar with some of those advocacy organizations.